A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well being day and night. Voice of Healthcare, along with our supporting partner Yashoda Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctors, which aims to showcase the diverse interests and passions of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So, starting with the introduction, I welcome Dr. Vaibhav Saxena, Senior Consultant, Urology, Uro-Oncology, Robotic Surgery and Renal Transplant, Yashoda Super Speciality Hospitals. Welcome, Dr. Saxena.
Yeah, hi Ritika, how are you?
I am doing good, sir. Wishing you a very happy Doctor's Day.
Same to you, Dr. Ritika. So,
So to begin with the conversation, have you traveled to any interesting or unique destination that has influenced your perspective on life or medicine?
yeah, I have recently I have gone to Spain where I saw the lifestyle of the persons and the doctors are very different from India. They do a lot of cycling, the physical activity, and they minimally use their personal conveyances. They use public conveyances routinely. So what I feel, if we imbibe all these good habits in our lifestyle, we can improve the health, our own health, our patients' health, the society. We can also help the government and the society, and we also can make the pollution, make our country, our environment more pollution free. So that was a very positive part. Apart from it, they were doing a lot of physical activities, routine exercises, and many more things which they were doing, especially in the Barcelona and the Madrid. And they have got a very organized healthcare system. Maybe we are also in the same way, and we will also be biggest democracy worldwide in the coming time with the best health care structure worldwide.
Yes, you have very rightly pointed out that as a doctor, their system they use public conveniences and to lessen the pollution, the effects of pollution. And as a doctor, you can set example for your patients as well. That this is the kind of physical activities that you are doing, and your patient can also do. And you are a uro-oncologist, so how do
Yeah,
you foresee the future of urology and renal transplant and robotics?
renal transplant, robotics, and uro-oncology.
Yeah.
When we started the transplant program, when we started the urology, then that time the urology was quite different from the right time urology. Then the surgeries were usually open 15, 20 years back, and the only thing which used to do as a surgery was the open surgery or some of the endoscopic surgery. But now with the advent of the new technologies, especially robot, majority of the stone surgeries, cancer surgeries, then kidney cancers, prostate cancers, all these surgeries are being done robotically now. The patient gets the relief from the post-operative pain and everything, and the recovery is very good, very quick. And usually he is able to go home by 2, 3 days. Apart from it, the oncological results, the results of the cancer surgery are also much better than the conventional open surgeries. So this drastic change, paradigm shift in the results and the outcomes we have seen recently, only with the advent use of the robot and the other technologies, lasers in the urological surgery. I foresee that with the time the usage of the advanced technology and the grade 4 generation robotic surgery will increase in different parts of the surgeries, not only urology, and which will improve the outcomes of the patients, the overall survival of the patients, and the more complicated or complex surgeries would be done. Apart from it, There are some targeted therapies are also available now, which will decrease the radical surgery's role with the time in the long term. But right now, this time is for the minimally invasive and the robotic surgery, which will gradually replace the conventional surgeries in the meantime.
Yes, and we are seeing that more and more conservative therapy options are now available in a lot of
Yeah.
cases, and robotic surgery is one such procedure, and targeted therapy is one such thing that we need to preserve as much as body parts as possible. So that is the future. That is how the future looks like, and hopefully
And
we see a lot of advancement as well.
you also asked for the renal transplant. So there is also under development the bionic kidney. So the bionic kidney would be a small kidney, which, however, it is in the under development, but in the our lifetime into next 10, 20 or 15, 20 years, we can see that there would be a kidney, and there would be no more need the
Dialysis.
for the transplant for the to remove the kidney from other person, the known person, and put it into the patient, dialysis patient. And this bionic kidney would be artificial kidney, which will work as the normal kidney. But the research is going on over it, and in next 1 or 2 decades, it should come into the use.
Yeah, we hope to see that soon as artificial hearts are coming up and there
Yeah.
is less dependency on donor patients. So we hope to see that advancement coming very soon in the near future. Moving on to your personal, any books or movies or documentaries
Yeah.
that had a significant impact in your personal or professional life.
Yeah, I have read some of the. I am very fond of reading, and I read a lot of books. I also run. I am a good runner. I daily run around 5 to 7 kilometers. So one of
That's
the books,
great.
one two.
That's
Thank you, thank you. So one or two books I would mention. First is the Infinite Vision. It is a book based on the Aravinda Hospital you would have seen, and it is a lesson for the MBA students in Harvard University. So Infinite Vision is the book of it is book which connects the humanitarian feelings, the humanitarian help which we can do as a doctor or as a human being to the society, and how we can connect it with the business model. So it is a very good book which I was really inspired to read, and what I feel that it can be many more such kind of infinite visions are required to develop India, because the population and the growth of our nation is too big. So it requires at least thousands of infinite visions to develop all the specialties, subspecialties of medical field. And the second book is being a surgeon. I like the books which a surgeon writes. So Dr. Sinha was a gynecologist. He's late, Dr. Sinha now. So he was a very good gynecologist and very famous gynecologist of Bombay, in Bombay Hospital. And he has written a book of Anatomy of Success. It is for the it is like the key points of the different parts of the life, and he has compared in this book with the life, the different targets, the different challenges in the life, with the way he used to tackle with different difficult cases in his surgeries or in his medical practice. So I found it very good book to read. So these are the two books which I like, and that's it.
I am writing those books down, and I hope to read them, the books that you have suggested. So it is a good suggestion for me as well. So I'll also try to read those books that you have suggested. Moving on to the last part of this conversation, what is the message that you would like to give to your fellow doctors this National Doctors Day?
Yeah, I would like to say that learning is a process, it's never the end result. And how long as you become the senior, you learn a lot with the smallest good deed or the mistake of yours or others. So always be a learner. Never think that you are complete. No, unless this appetite is not under in you, you will not reach your ultimate target. And never be satisfied with small things, which I never. So these are the two
That's
important messages I would like to give to my fellow doctors.
that's very good to know that you have very rightly said that you never stop learning in any process, any part of your life. You learn something or the other from each and every aspect of life, and you should
Even
never
your
be. Yeah.
even your subordinate, your junior, your staff, every person has something to teach you.
These are very good lines that you should never be complacent. You should never get satisfied of what you have. You should ask for more, learn for more. So,
Yeah.
thank you so much, Dr. Saxena. With this, I would like to end this conversation here, and I would like to thank you and all the doctors who selflessly serve our nation's health. So together, we salute your dedication, compassion, and unwavering commitment to our health. Thank you so much, Dr. Saxena.
Thank you,
Thank
Dr.
you.
Ritika. Thank you very much. Thanks a lot.